This kind of a conference is absolutely critical to hold. I wish it were held more frequently. It really allows all types of researchers to gather to talk about ovarian cancer, talk about the problems, where we've come, where we're headed, what our goals are.
Well, this is a unique opportunity to bring together people all the way from trainees to some of the most mature investigators. We want this to be a conference where we actually discuss the issues that are raised. So often at conferences, by the end of the regular talks, nobody wants to discuss things. We want to save plenty of time for discussion and also to actually pose the critical questions.
Bob Bass brings his expertise around early detection, prevention. Anil Sood has one of the most successful laboratories in ovarian cancer certainly in the world. And I'm more of a translational researcher, but also a clinical trial researcher as well. All three of us take care of patients with ovarian cancer, so we all have that understanding of the burden that this cancer brings to a patient and subsequently her family as well.
Well, this conference is just the right size. It's large enough to have a critical mass of established investigators, new investigators, trainees, and advocates who are passionately interested in doing something about ovarian cancer. And it's small enough that you can communicate, you can network, and you can develop collaborations.
It allows the experts in the field and those who are interested in the field, who are up and coming, to gather together to talk about what the problems are in ovarian cancer, all the way from basic science to translational, then to the execution of clinical trials that are able to make a difference in patients' lives and really improve where we are on the treatment of ovarian cancer.
We've planned special events for young investigators. Before the keynote addresses at the end of the first day, we're going to have a training session for young investigators where we'll cover the molecular and the clinical biology of ovarian cancer, update where we are in prevention and early detection, and also talk about therapy, both conventional and novel. And then it'll also be possible during the conference to network, and we're having special sessions to look for career opportunities, both for postdoctoral fellowships and also for faculty positions.
We're inviting advocates to come to tell their stories about how the cancer has impacted them, their families, so that there's that personal connection between patients and investigators, specifically junior investigators.
There'll be different sessions that'll include the genomics of ovarian cancer and identifying drivers. There's work in metabolics and also the cell microenvironment. We'll talk about drug resistance and also prevention and early detection, as well as rare tumors.
When we think about ovarian cancer, it is not just one cancer. So when you think about the most common subtype, high-grade serous ovarian cancer, the most exciting breakthroughs in that area have been around exploiting DNA repair and use of PARP inhibitors, PARP inhibitor combinations, so using something else besides the PARP inhibitor to induce a state of homologous recombination deficiency and make that PARP inhibitor thus work better. So what excites me is that there's so much going on in other fields, that the genomic and genetic analysis of tumors is becoming less expensive, so we can do more with less. We have major strides made in other cancers, such as lung cancer, melanoma, where we can use those types of therapies around specifically immunotherapy and then apply them to ovarian cancer.
We've found that 80% of all ovarian cancers at second look operations are undergoing self-eating or autophagy. And that provides a target that cuts across the usual drug resistance. You can either inhibit autophagy or you can drive cells to autophagic death.
The research is clearly benefiting patients. There have been new agents that have been developed for ovarian cancer. The ovarian cancer field has been a leader in the development of PARP inhibitors the understanding of how they work, and really taking that agent and then applying it to other tumors, breast cancer, prostate cancer, pancreatic cancer.